Welcome. You've joined us for a focused exploration right here on the Deep Dive. Today, we're untangling the complexities of aortic stenosis.
Yeah, we're diving into some pretty detailed medical info to really get a handle on this condition.
Exactly.
Yeah.
Our mission for you today is to pull out a really clear, straightforward understanding of aortic stenosis. What it is, what causes it, and what it actually means for an animal's health. We want to cut through the jargon.
Get right to the essentials.
Right. And it's quite something, isn't it? This narrowing affecting how blood leaves the heart. It has these surprising genetic links, and the impact varies so much, sometimes no signs at all initially.
But it can be very serious, even leading to sudden death in severe cases.
Okay, so let's jump right in. What is aortic stenosis in simple terms?
Okay, so basically it's a narrowing in the pathway, the exit route from the left ventricle. That's the heart's main pumping chamber.
Right.
Imagine squeezing a garden hose. It restricts the flow. Here, it restricts oxygen-rich blood going to the body.
Okay, that makes sense.
And what's interesting is that it's often something an animal is born with that's congenital, and quite often it runs in families, it's heritable.
So it's often genetic then. And where exactly does this narrowing usually happen in the heart?
Well, in dogs, the most common spot is just below the aortic valve. That valve controls the flow out, remember? We call that subvalvular aortic stenosis, or SAS.
Okay, below the valve in dogs. What about cats?
In cats, it's a bit different. It can be subvalvular, but it might also be at the valve itself valvular, or even just above it, which we call supravalvular.
Gotcha. So location varies.
Mm.
Focusing on dogs for a sec, that common subvalvular type, what actually causes that narrowing below the valve?
It's usually extra fiber and tissue forming there. It's not normal muscle.
Fibrous tissue, like scar tissue.
Sort of, yeah. It can look like little bumps, or sometimes it forms a distinct ridge or even a whole ring right around the opening. In some cases, it can be more extensive, almost like a tunnel. And it's worth noting, this SAS in dogs sometimes shows up alongside other heart problems, like issues with the mitral valve, the valve on the other side of the left ventricle.
Right, so a physical blockage. Now, talk us through the knock-on effects. What happens because of that restriction? The domino effect, if you will.
Okay, so when that exit path is narrowed, the left ventricle has to work much, much harder to pump the blood out.
Makes sense.
This extra effort leads to a big increase in pressure inside that chamber. We call it pressure overload. And how bad that overload is? Well, it depends entirely on how narrow the opening is.
A tighter squeeze means more pressure. So what does all that extra work do to the heart muscle itself over time?
Well, the heart tries to adapt. The muscle wall of the left ventricle gets thicker. It hypertrophies. Think of it like a bodybuilder's muscle getting bigger to lift heavier weights.
Okay.
But there's a downside. This thicker muscle needs more oxygen and nutrients than the heart's own blood supply can easily deliver. This creates a mismatch.
Not enough fuel for the bigger engine.
Exactly. That situation is called myocardial ischemia, lack of sufficient oxygen to the heart muscle.
And ischemia sounds bad. What problems can that cause?
It can cause big problems. When the heart muscle is starved for oxygen, it can become electrically unstable. That leads to abnormal heart rhythms, or arrhythmias.
Irregular heartbeats. Okay.
And if the ischemia is really severe or prolonged, parts of the heart muscle can actually die. That's myocardial infarction, basically a heart attack. That, of course, seriously weakens the heart's ability to pump, mechanical dysfunction.
That sounds incredibly serious. You also mentioned earlier that the blood flow gets turbulent as it goes through the narrow bit.
Yeah, that's another key part. Forcing blood through that tight spot at high speed creates this rough, swirling flow, like rapids in a river instead of a smooth stream.
Right.
And this turbulent flow can physically damage the delicate inner lining of the aorta, the big artery leaving the heart. That's called endothelial damage.
Okay, so damaging the pipe itself, what does that lead to?
Two main things. First, the damage near the aortic valve can stop the valve leaflets from closing properly. So some blood leaks back into the left ventricle after it pumps. That's aortic insufficiency or regurgitation.
Making the heart work even harder.
Exactly. And second, that damaged lining is like rough ground where bacteria can more easily latch on and start an infection. That's endocarditis, a very serious infection of the heart lining or valves.
Why? So the narrowing itself creates conditions ripe for infection. It really is a cascade of problems. What's the longer-term picture if it keeps progressing?
Well, over time, that constant high pressure can stretch out the left ventricle. The chamber enlarges. This stretching can also distort the nearby mitral valve apparatus.
The other valve.
Yeah, leading to mitral regurgitation, blood leaking backwards through that valve too. And eventually, if things get bad enough, the heart just can't keep up. It fails to pump effectively, fluid backs up, often into the lungs. That's left-sided congestive heart failure.
Congestive heart failure. And you mentioned the most critical risk earlier.
Yes, absolutely. With severe aortic stenosis, there's always this underlying risk of sudden death. It could be triggered by one of those dangerous arrhythmias or maybe a significant myocardial infarction. It's very real danger.
So clearly the cardiovascular system bears the brunt. But does it spill over into other body systems?
Primarily, yes, it's cardiovascular, all those things we just discussed. Pressure overload, arrhythmias, fainting, sudden death, potential heart failure, endocarditis risk. But if congestive heart failure develops,
Then the lungs get involved.
right, you get pulmonary edema fluid in the lungs, which impacts the respiratory system, difficulty breathing, coughing. And in really severe cases, if the heart's output is very low, or if endocarditis spreads infection through the bloodstream, you could potentially see effects across multiple systems. Low blood flow impacts everything eventually.
Let's shift gears a bit and talk about the genetics you mentioned. It runs in families, especially certain dog breeds.
Yes, definitely. There are several breeds where we know there's a strong inherited component to subvalvular aortic stenosis. Newfoundland dogs are a big one, golden retrievers, Rottweilers, and the Dogue de Bordeaux, too.
Have scientists pinpointed the actual gene responsible?
For Newfoundlands, yes. They've identified a mutation in a gene called PICALM. It's involved in intracellular trafficking, how things move around inside cells.
Ricellum.
And because they found that specific mutation, there's actually a genetic screening test available now for Newfoundlands.
Oh, that's huge for breeders, presumably.
Absolutely. It gives them a tool to help reduce the frequency of SAS in the breed.
What about the other breeds, like Goldens or Rottweilers? Is the inheritance pattern clear there?
It's less definitively mapped out. The thinking is that it might be a dominant inheritance pattern, but with incomplete penetrance.
Incomplete penetrance. What does that mean, practically?
It means an animal can inherit the gene or genes for SAS, but not actually develop the condition or only develop a very mild form. So the gene is there, but it doesn't always fully express itself.
Ah, so it can look like it skips a generation sometimes.
Exactly. Makes it trickier to track through pedigrees. It also suggests that it's probably not just one single gene in many breeds. It's likely polygenic, multiple genes involved, or there might be other modifying genes influencing whether or how severely the condition develops. It's complex.
Definitely sounds complex. So how common is this condition overall? Is it something vets see a lot?
In dogs, yes. Subvalvular aortic stenosis is considered one of the most common congenital heart defects. Some sources say it's the second most common.
Second most common.
Wow. Though the true number might actually be higher, because as we'll discuss, mild cases can be really subtle and easy to miss without specific diagnostics.
Okay, and what about cats?
It's less common in cats compared to dogs. It accounts for maybe around 6% or so of congenital heart disease diagnosed in cats. If you look at data from vet teaching hospitals, they diagnose some form of this outflow obstruction, SAS, in dogs, or similar issues in cats in roughly 2 out of every 1,000 dogs and maybe 0.2 per 1,000 cats.
So much more common in dogs, but still occurs in cats. When we talk about who gets it, the signalement besides breed, are there other factors, like age or sex?
Well, we know it affects both dogs and cats.
Yeah.
In dogs, besides those top breeds like Newfoundlands and Goldens, we also see it fairly often in Bouvier de Flanders, German Shepherds, Boxers.
Okay.
And then there's another group with an increased risk, maybe not as high incidence, but still higher than average. That includes English Bulldogs, Amstaffs, Bull Terriers, Great Danes, Samoyeds. Quite a list.
Quite a list indeed, and for cats.
Interestingly, no specific breed predisposition has really been consistently reported in cats. It seems more random across the feline population.
And age. You said it's congenital, but does it show up right at birth?
It is congenital, meaning the predisposition is there from birth, but the actual physical narrowing, that fibrous ridge in dogs, often develops progressively during the first few weeks or months of life. So, a murmur might not be obvious right away, but becomes detectable as the puppy grows. Usually the full severity is apparent by the time they're around a year old.
So it develops over the first year. And any difference between males and females?
The sources don't really specify a strong sex predilection. Seems to affect both males and females.
Okay. So we know who's at risk. How would an owner, or maybe a vet, during a checkup for suspect aortic stenosis, what are the clues?
Well, the tricky part is that many affected dogs, especially those with mild or even moderate SAS, show absolutely no outward signs. They seem perfectly normal.
Right, the silent cases.
But when signs do appear, they usually correlate with how severe the narrowing is. Owners might report fainting episodes, particularly with excitement or exercise, or they might notice their dog just can't keep up like they used to exercise intolerance.
Getting tired easily.
Exactly. And then, in the most severe outcomes, there could be sudden, unexpected death, unfortunately. Or, if it's progressed to heart failure, owners might see signs like difficulty breathing, maybe rapid breathing, or coughing.
So those are things an owner might observe.
Yeah.
What about the vet exam? What are they listening or feeling for?
The absolute key finding on a physical exam is a heart murmur. Specifically, a systolic murmur that means it happens when the heart is contracting, pushing blood out.
Okay.
And it's typically loudest when listening high up on the left side of the chest, near the base of the heart, sort of under the armpit area. It can often radiate, though, meaning the vet might hear it in other places too, like up towards the neck.
And can they feel anything?
Sometimes, yes. If the murmur is really intense, the vet might feel a vibration through the chest wall when they place their hand there. That's called a precordial thrill, like a buzzing feeling.
A thrill. Okay. Does how loud the murmur is tell you how bad the stenosis is?
You'd think so, but it's not a perfect correlation, unfortunately. You can have severe SAS with only a moderately loud murmur, and sometimes mild SAS can have a surprisingly loud one. Plus, in young, growing animals, the loudness can actually change over time as they develop. So it's a clue, but not the whole story.
Good to know.
Any other sounds? Yeah, if there's also that aortic valve leak, we talked about aortic insufficiency, the vet might hear a second murmur, this one happening when the heart relaxes, a diastolic murmur. If both are there, it's sometimes described as a to and fro sound.
Okay.
The vet might also pick up on arrhythmias, those irregular heartbeats, just by listening. And they'll always check the pulses, usually feeling the artery in the back leg. With severe SAS, the pulses might feel weak or maybe delayed compared to the heartbeat. That suggests the heart is struggling to push enough blood out forcefully.
Weak pulses. Right.
And of course, if the animal is in congestive heart failure, the vet might hear crackles in the lungs when listening with the stethoscope and observe rapid or labored breathing.
Are there any sort of breed-specific things to keep in mind when examining?
Yeah, a few. For boxers, they naturally tend to have a slightly smaller aorta relative to their size, which can sometimes make it harder to definitively diagnose very mild SAS just based on measurements alone.
Okay.
Bull terriers, as we mentioned, have a higher tendency to have both mitral valve problems and SAS together, so vets need to look for both.
Double trouble.
And Newfoundlands. Well, besides being prone to SAS, they can also have another common congenital heart defect called patent ductus arteriosus, or PDA. If both are present, the PDA can sometimes mask the murmur or other signs of mild SAS, making the diagnosis a bit more complicated.
Lots of nuances there. Okay, so we've covered what it is, who gets it, how it shows up. Let's dig into causes and risks again. Primarily congenital, you said.
Yes, overwhelmingly, the subvalvular type in dogs is congenital heart disease, born with the tendency for it to develop.
But are there other ways aortic stenosis can happen, maybe later in life?
Less commonly, yes. Changes to the aortic valve itself could cause stenosis. For example, if the valve gets a severe infection endocarditis that could damage it and lead to narrowing. Or sometimes, especially in older animals, calcium can build up on the valve, making it stiff and narrowed. That's more like acquired aortic stenosis.
Okay, acquired causes.
And in cats, specifically those with a common heart muscle disease called hypertrophic cardiomyopathy, or HCM,
Right, HCM in cats.
they can develop a dynamic obstruction in the outflow tract. The muscle gets so thick it actually blocks the exit path during contraction. This isn't exactly the same as the fixed fibrous ring in dogs, but it causes a similar problem, restricted outflow. It can sometimes be fixed, sometimes it varies.
So HCM can mimic or cause a similar issue in cats.
Right. And as we touched on, SAS can occasionally be just one part of a more complex set of congenital heart defects, sometimes seen with severe mitral valve dysplasia.
Got it. And the risk factors. Besides being one of those predisposed breeds?
Well, having a known family history of SAS is the big one for the congenital form. If parents or siblings had it, the risk is higher.
Makes sense.
We also know there's a bit of a two-way street with endocarditis. Having SAS, especially if the valve is also affected, increases the risk of developing aortic valve endocarditis.
Yeah.
But also, having endocarditis first could potentially cause secondary stenosis if the valve heals badly.
A vicious cycle, potentially.
And for cats, having HCM is definitely a risk factor for developing that dynamic left ventricular outflow tract obstruction.
Okay, so the vet hears that typical murmur, maybe feels weak pulses, considers the breed. How do they confirm it's really aortic stenosis and not something else? What's the diagnostic process?
Yeah, that murmur is the main starting point, but you have to rule out other things. Differential diagnosis is key.
Like, what else could cause a similar murmur?
Well, especially in young athletic dogs or animals that are just stressed, anemic, or have a fever, you can get what are called innocent or physiologic flow murmurs. They sound similar, but aren't caused by a structural defect.
Innocent murmurs.
Oh, okay. Then there are other congenital heart defects. Pulmonic stenosis narrowing on the right side of the heart can cause a murmur in a similar location. Things like tetralogy of Fallot or ventricular or atrial septal defects, holes between chambers, can also cause murmurs.
So other heart issues need to be considered.
Exactly. And if the pulses are weak, the vet needs to think about other conditions that reduce cardiac output, not just SAS. Things like severe heart muscle disease or low blood volume.
Right. What about basic lab tests? Blood counts, chemistry panels, urinalysis, do they help?
Generally, no. For uncomplicated aortic stenosis, those routine tests, CBC, chemistry, UA, are typically completely normal. They're useful for checking overall health or ruling out other issues, but they don't diagnose SAS itself.
So not the primary tools here. Any other lab tests? You mentioned the genetic one.
Right, the PICAL-M gene test in Newfoundlands is really valuable, mostly as a screening tool for breeders to make informed decisions and try to reduce the incidence in future generations. It's not typically used to diagnose an individual dog that already has clinical signs.
Okay, so genetics for breeding. What about imaging? X-rays.
Chest x-rays or thoracic radiographs can sometimes give us clues, but they're often subtle, especially in mild disease. The heart might look totally normal on x-ray.
So not always helpful?
Not always definitive. In more moderate or severe cases, you might see some signs suggesting the left ventricle wall is thicker than normal. You might see enlargement of the left ventricle or the left atrium. You might also see a bulge in the aorta just after the narrowing. It's called post-stenotic dilation. And of course, if there's congestive heart failure, you'll see evidence of fluid in the lungs. But x-rays don't let you see the actual narrowing itself.
Okay, so for seeing the actual structure and the narrowing, you need
Echocardiography, an ultrasound of the heart. That's really the gold standard for diagnosing aortic stenosis.
the echo. What does that show you?
It gives us a detailed, real-time look. We can often directly visualize the narrowing that fibrous ring or ridge below the valve in dogs. We can measure the thickness of the heart walls to confirm hypertrophy.
See the thickening.
Exactly. We can look closely at the aortic valve leaflets themselves. Are they thickened, moving abnormally? Check the mitral valve, too. We can see that post-stenotic dilation of the aorta if it's present. Sometimes we can even see indirect signs suggesting the heart muscle isn't getting enough oxygen, like areas that aren't contracting well.
Wow, very detailed.
And crucially, echo uses Doppler technology to measure blood flow velocity. As blood speeds up through the narrowed area, we can measure that increased speed. A flow velocity above about 2.4 meters per second coming out of the left ventricle is generally considered abnormal and indicative of stenosis.
So you measure the speed of the blood jet.
Right. And from that peak velocity, we can use an equation, the modified Bernoulli equation, to estimate the pressure gradient across the stenosis. That's the pressure difference between the left ventricle and the aorta.
The pressure drop.
Yeah, essentially how much extra pressure the ventricle is generating. And we use that pressure gradient to grade the severity, typically mild, moderate, or severe. Mild might be 25-49 millimeters G, moderate 50-79, and severe is usually considered 80 millimeters G or higher.
Okay, so echo gives you the structure and the severity estimate.
Precisely. Though, one caveat, if the heart muscle is already failing and weak, it might not be able to generate a very high pressure, so the gradient might seem falsely low even if the narrowing is severe. Echo helps assess that overall function too. Sometimes we can also try to calculate the effective valve orifice area, basically how small the opening really is.
So echo is really the key diagnostic test here. Are there other procedures sometimes used, like an ECG?
An ECG, an electrocardiogram, is often done. It records the heart's electrical activity. It won't diagnose the stenosis itself, but it can show changes consistent with left ventricular hypertrophy, bigger electrical signals. It can also show patterns suggestive of myocardial ischemia, that lack of oxygen.
And arrhythmias.
Yes, absolutely. The ECG is crucial for detecting any arrhythmias, especially those ventricular arrhythmias that can be dangerous.
What if the arrhythmias aren't happening right when you do the ECG?
That's where Holter monitoring comes in. If an animal has symptoms like fainting, or if we suspect intermittent arrhythmias, we might send them home wearing a small portable ECG recorder for 24 hours or longer.
Like a heart monitor people wear.
Exactly. It gives us a much longer look at the rhythm to see if significant arrhythmias are happening, how often, and how serious they are. Helps guide treatment decisions.
Okay. And you mentioned pathology findings briefly if an animal passes away.
Yes, if a necropsy, a post-mortem exam is performed, the pathologist would typically find that thickened left ventricular wall. They'd see the actual fibrous lesion below the valve, maybe evidence of chronic ischemia or small infarcts in the heart muscle, that widening of the aorta after the stenosis, and possibly an enlarged left atrium. It confirms the diagnosis structurally.
Right. So putting it all together, you arrive at a diagnosis and severity. What are the options for treatment and managing aortic stenosis?
Well, the main goal of treatment, especially before major complications arise, is really focused on trying to prevent clinical signs like fainting, slowing any progression, and crucially, reducing the risk of sudden death.
Prevention of the worst outcomes.
Exactly. If an animal is having symptoms like arrhythmias, fainting, or signs of heart failure, then specific nursing care and medical management for those symptoms is needed.
What about things like exercise?
Activity restriction is generally recommended, especially for dogs with moderate to severe SAS. We want to avoid really strenuous activity or intense excitement that puts a sudden high demand on the heart, as that could trigger arrhythmias or fainting. Gentle leash walks are usually okay, but no intense fetching or running alongside a bike.
Okay, keep things calm. Any dietary changes?
Not usually for uncomplicated SAS, but if the animal develops congestive heart failure, then a diet with modest sodium restriction is often advised to help manage fluid retention.
And owner education must be huge here.
Absolutely critical. Owners need to understand that this is often an inherited condition, and therefore affected animals really shouldn't be bred. That's key for reducing it in the future.
No breeding. What else?
They need to be aware of that increased risk of endocarditis, the heart infection. That means discussing the need for prophylactic antibiotics before certain procedures, like dental work, or even treating skin or urinary tract infections promptly and aggressively.
Prevent bacteria getting to the heart.
Right. And importantly, owners need to understand the serious risks associated with severe SAS sudden death, the potential for developing heart failure, and also the significantly increased risk involved if the animal needs anesthesia for any reason. It requires careful planning.
That's a lot for an owner to take in. What about fixing the narrowing itself? Surgery, interventions.
That's the tough part. Currently, surgical options or interventional procedures like trying to stretch the narrowing open with a balloon catheter, valvuloplasty, haven't consistently shown a significant survival benefit compared to just managing the condition with medication.
Really? So opening it up doesn't necessarily help long term.
The procedures can sometimes temporarily reduce the pressure gradient and might improve symptoms like fainting for a while. But studies haven't clearly demonstrated that they actually make dogs live longer than those managed medically, primarily with beta blockers. Plus, these procedures carry their own risks and aren't widely available. So right now, they aren't the standard go-to treatment. Medical management is the mainstay.
Okay. Medical management. What drugs are used? You mentioned beta blockers.
Yes, beta blockers are generally considered the drug class of choice for dogs with moderate to severe subvalvular aortic stenosis, especially if they have clinical signs like fainting, documented arrhythmias, or ECG evidence of myocardial ischemia.
How do beta blockers help?
They work in a few ways. They slow the heart rate, which reduces the oxygen demand of that thickened heart muscle. Less work, less oxygen needed. Slowing the rate also gives the ventricle more time to fill between beats, which can improve efficiency. And importantly, they help suppress those dangerous ventricular arrhythmias that can lead to fainting or sudden death.
Okay, multiple benefits. Which ones are commonly used?
Atenolol is probably the most commonly prescribed beta blocker for SAS in both dogs and cats. Others like carvedilol or metoprolol might sometimes be used. The veterinarian will choose the best one and determine the appropriate dose, usually starting low and increasing gradually. Of course, if the animal has developed other complications like overt heart failure or significant ongoing arrhythmias, other specific medications for those issues would be added as needed.
Are there times when beta blockers shouldn't be used? Any contraindications?
Yes, they should generally be avoided or used with extreme caution in animals that have airway diseases where constriction is a problem, like feline asthma, because beta blockers can potentially worsen that.
Okay, careful with asthma.
And starting beta blockers in an animal that is already in active decompensated congestive heart failure is usually contraindicated, as they can potentially worsen the heart's pumping ability initially. You typically need to stabilize the heart failure first.
Got it. Any other precautions when using them?
Well, because they can reduce cardiac output, it's standard practice to start with a low dose and slowly increase it over time, monitoring the animal for any negative effects like lethargy or weakness. Gradual dose titration is key.
Start low, go slow.
Exactly. Also, a point about heart failure management if it develops with SAS, using drugs called positive inotropes, which make the heart contract more forcefully, needs careful consideration. In the face of a fixed obstruction like SAS, making the heart pump harder against that blockage could potentially worsen the obstruction or increase oxygen demand dangerously. So it's complex.
Tricky balance.
And as I mentioned with anesthesia, drugs that significantly lower blood pressure, predispose to arrhythmias, or depress heart muscle function need to be avoided or used very cautiously in animals with severe SAS. Anesthetic protocols need careful tailoring.
Definitely sounds like managing severe SAS requires careful handling. So once an animal is diagnosed and potentially on medication, what does the follow-up involve? How are they monitored?
Regular monitoring is crucial. This often involves repeat physical exams, listening for changes in the murmur. Repeat ECGs are important to check the heart rhythm and look for those ischemic changes.
Checking for arrhythmias.
Right. Holter monitoring might be repeated periodically, especially if fainting was an issue, to see how well arrhythmias are controlled. Chest x-rays might be used to monitor overall heart size and check for early signs of fluid buildup in the lungs.
And repeat echoes.
Yes, serial echocardiograms are very important. They allow us to reassess the severity of the stenosis. Has the pressure gradient changed? How thick are the heart walls now? And critically, how well is the left ventricle functioning overall? Is it coping, or are there signs of deterioration?
So keeping a close eye on structure and function.
Exactly. And if the animal is being treated for complications like heart failure, then monitoring things like kidney function and electrolytes through blood tests also becomes important, as the medications can sometimes affect those.
Okay. Is there anything that can actually be done to prevent aortic stenosis in the first place?
Since it's primarily congenital and inherited, there's really no way to prevent it from developing in an individual animal that's genetically predisposed. The only real prevention is at the population level through responsible breeding practices.
By not breeding affected animals.
Precisely. Screening potential breeding animals, especially in those high-risk breeds, using methods like echocardiography or the genetic test where available, and removing affected animals from breeding programs is the key to reducing its incidence over generations.
Makes sense. Finally, let's talk about the outlook. What are the potential complications down the road, and what's the expected course or prognosis?
We've touched on most of the complications. Those ventricular arrhythmias leading to fainting or sudden death, myocardial infarction, heart attack, the development of aortic insufficiency, that leaky valve, medral regurgitation if the chamber stretch affects that valve, congestive heart failure, and of course that risk of endocarditis.
Quite a list of potential problems.
It is, and the expected course and prognosis really hinge on the severity of the stenosis.
So mild cases might be okay?
Yes, animals diagnosed with mild SAS, say with a low pressure gradient on echo, may well live a completely normal lifespan with no clinical signs and might not require any treatment at all, just monitoring.
That's good news for some, but the severe cases.
Animals with severe SAS, unfortunately, have a significantly guarded prognosis and a shorter expected lifespan. They are at high risk for those major complications we listed, particularly sudden death or progression to congestive heart failure, even with medical management like beta blockers.
It helps, but doesn't cure it.
Exactly. It aims to manage risks and potentially prolong life, but it doesn't fix the underlying mechanical problem. There was one study looking at dogs with severe SAS treated with atenolol, and the median survival time reported was around 54 months, so about 4.5 years from the time of diagnosis and starting treatment.
4.5 years on average. That puts it in perspective.
It does. It highlights that while we can manage it, severe SAS remains a very serious condition.
Okay, so wrapping up our deep dive today on aortic stenosis. We've learned it's this narrowing of the heart's outflow tract, often congenital and inherited in certain dog breeds.
Caused by that fibrous tissue below the valve in dogs, typically.
And it sets off this whole cascade: pressure overload, heart muscle thickening, risk of oxygen starvation, arrhythmias, valve damage, infection risk.
Leading potentially to heart failure or tragically sudden death, especially in severe cases.
We've seen diagnosis relies heavily on echocardiography to assess the structure and measure that pressure gradient, guiding severity.
And treatment focuses mainly on medical management with beta blockers to control risks, as surgery isn't currently proven to offer better long-term survival.
Right. It's really clear that while animals with mild forms might live full lives, severe aortic stenosis carries significant challenges and risks. It's a complex condition requiring careful management. So thank you for joining us for this in-depth exploration. And as a final thought for you to consider, given that strong genetic link in breeds like Newfoundlands, Golden Retrievers, and others, what are the broader ethical considerations around continuing to breed animals with known, sometimes high, predispositions to serious, potentially life-limiting conditions like severe aortic stenosis? Something to ponder. We appreciate you tuning in.